Part 1. The Truth About Joint Pain After 60. Why this topic matters. Joint pain is one of the most common and debilitating issues affecting people over the age of 60. It doesn't just cause physical discomfort, it can rob individuals of their mobility, independence, and quality of life. But what exactly causes joint pain after 60? Why does it become more prevalent with age? And most importantly, what can be done about it? Before diving into the debate between natural and prescription treatments, we need to first understand the root of the issue. This section will explore the biological and lifestyle-related causes of joint pain in seniors, highlight the different types of joint disorders, and demonstrate how joint pain affects both the body and mind. By the end of this section, you will have a clear, science-based understanding of why joint pain becomes more common after 60, and why taking action early matters. 1. The aging body. What happens to your joints after 60? Joints are remarkable structures, designed to provide both flexibility and stability. They allow us to walk, bend, stretch, and move through life. However, as we age, the natural wear and tear on our joints accumulates. Here's what happens. Cartilage breakdown. Cartilage is the smooth, rubbery tissue that cushions your joints. Over time, it wears down, leading to friction between bones. Decreased synovial fluid. This fluid lubricates your joints. With age, its production diminishes, making joints stiff and painful. Bone spurs. As cartilage erodes, bones may develop abnormal growths called bone spurs, which can restrict movement and cause pain. Ligament and tendon stiffness. Ligaments and tendons become less elastic, reducing range of motion. Muscle loss. Sarcopenia, loss of muscle mass, with age increases pressure on joints, further aggravating pain. These changes are part of the natural aging process, but can be accelerated or worsened by factors such as poor diet, lack of exercise, injury, or underlying medical conditions. 2. Common types of joint pain in seniors. Joint pain in people over 60 can stem from several different conditions, each with its own causes and symptoms. Understanding these can help with proper diagnosis and treatment. Osteoarthritis, OA, the most common type of arthritis, caused by wear and tear on the joints. Symptoms include pain, stiffness, and reduced mobility, especially in weight-bearing joints like the knees and hips. Rheumatoid arthritis, RA, an autoimmune disorder where the immune system mistakenly attacks joint tissues, causing inflammation, swelling, and pain. Gout, caused by the buildup of uric acid crystals in joints, often triggered by diet. It typically affects the big toe and causes sudden, intense pain. Bursitis, inflammation of the fluid-filled sacs, bursae, that cushion joints, often caused by repetitive motion or pressure. Tendinitis, inflammation of tendons, typically due to overuse. Commonly affects the shoulders, elbows, and knees. Each condition requires a different treatment approach, and sometimes they can overlap. 3. The impact of joint pain on daily life. For many people, joint pain is not just an occasional annoyance, it's a life-altering condition. It can limit physical activity, increase the risk of falls, and reduce overall independence. Mobility challenges. Joint pain can make walking, climbing stairs, or standing for long periods difficult. Loss of independence. Tasks like cooking, cleaning, and dressing may require assistance. Emotional effects. Chronic pain is associated with higher rates of depression, anxiety, and social isolation. Sleep disruption. Pain can interfere with sleep quality, which in turn exacerbates fatigue and inflammation. Cognitive decline. There is emerging research linking chronic inflammation to cognitive issues in older adults. Understanding these impacts underscores the importance of managing joint pain proactively. 4. Risk factors that make joint pain worse after 60. While aging is inevitable, some factors can significantly increase the likelihood or severity of joint pain. Obesity. Extra weight adds stress to joints, particularly knees and hips. Sedentary lifestyle. Lack of movement leads to muscle weakness and joint stiffness. Poor posture. Bad body mechanics strain joints over time. Previous injuries. Old injuries may resurface or worsen with age. Smoking and alcohol, both are linked to increased inflammation and poor bone health. Diet high in sugar and processed foods. These promote systemic inflammation, which can worsen joint pain. By modifying these risk factors, seniors can significantly improve their joint health and reduce pain. 5. Why early intervention matters. Many people wait until joint pain becomes unbearable before taking action. However, early intervention can dramatically change the course of joint health in later years. Delays damage. Early action can prevent or slow cartilage breakdown. Improves quality of life. Less pain means more mobility, social interaction, and independence. Reduces need for aggressive treatments. Managing pain early with lifestyle changes can reduce the need for surgery or heavy medication later. Supports mental health. Taking control of pain improves confidence and reduces emotional distress. Recognizing the early signs of joint trouble, such as morning stiffness, joint clicking, or pain after activity, can help prevent long-term disability. Conclusion: the foundation for a smart treatment choice. Understanding the truth about joint pain after 60 is the foundation for making informed treatment decisions. Whether you choose a prescription medication, a natural approach, or a combination of both, the most important step is to take action. Joint pain may be common with age, but it is not inevitable, and it certainly doesn't have to control your life. In the next section, we'll dive into prescription medications, how they work, when they're effective, and what risks they carry for older adults. This knowledge will help you weigh your options wisely and move toward lasting relief. Part 2. Understanding prescription treatments for joint pain. Why prescription medications are often the first line of defense. When joint pain becomes unbearable, most people's first instinct is to turn to medication. For seniors over 60, this is especially true, as they seek fast relief from persistent discomfort. Doctors often prescribe drugs to help manage pain, reduce inflammation, or slow down the progression of joint disease. But while medications can be effective, they're not without risks, especially in older adults, whose bodies metabolize drugs differently. In this section, we'll break down the most commonly prescribed medications for joint pain, how they work, their pros and cons, and what to watch for if you or a loved one over 60 is considering or already taking these medications. 1. NSAIDs, nonsteroidal anti-inflammatory drugs. NSAIDs are one of the most commonly used medications for joint pain relief. They work by blocking enzymes that cause inflammation, thereby reducing swelling and pain. Examples: ibuprofen, Advil, naproxen, Aleve, diclofenac, meloxicam. Pros: effective for mild to moderate pain and inflammation, available both over the counter and by prescription. Risks for seniors: stomach issues. NSAIDs can irritate the stomach lining and lead to ulcers or bleeding. Kidney strain. Long-term use can damage the kidneys, especially in seniors with pre-existing kidney conditions. Heart concerns. Some NSAIDs may increase the risk of heart attack or stroke. Safety tips: always take NSAIDs with food. Avoid combining multiple NSAIDs. Use the lowest effective dose for the shortest duration. 2. Acetaminophen, Tylenol. Acetaminophen is another common pain reliever, often recommended as a first-line treatment for osteoarthritis. How it works: unlike NSAIDs, it does not reduce inflammation. Instead, it works on the brain's pain perception. Pros: fewer stomach problems compared to NSAIDs, generally considered safe in moderate doses. Risks: liver toxicity. High doses can harm the liver, especially when combined with alcohol or other medications. Dosage caution: never exceed 3,000 milligrams per day. Check labels for hidden acetaminophen and other combination medications, like cold and flu remedies. 3. Corticosteroids, steroid injections and pills. Steroids are powerful anti-inflammatories that can be taken orally or injected directly into the affected joint. Examples: prednisone oral, methylprednisolone injection, triamcinolone. Benefits: rapid relief from inflammation and pain. Risks for seniors: bone thinning, osteoporosis, increased blood sugar levels, weight gain and mood swings, weakened immune system, potential joint damage if overused, especially with injections. Guidelines: steroid injections should be limited to 3 to 4 times per year in the same joint. Long-term oral use should be closely monitored. 4. DMARDs, disease-modifying antirheumatic drugs. Used primarily in inflammatory types of arthritis, such as rheumatoid arthritis. DMARDs aim to slow down the disease process, not just relieve symptoms. Examples: methotrexate, hydroxychloroquine, sulfasalazine. Pros: helps preserve joint structure and function over time. Risks: liver and lung damage, weakened immune system, frequent blood testing required to monitor side effects. Note: these medications often take weeks or months to show results and are usually combined with other treatments. 5. Biologic therapies. Biologics are a newer class of DMARDs, often prescribed for patients who don't respond well to traditional drugs. They target specific parts of the immune system. Examples: Humira, Enbrel, Remicade. Delivery: usually given by injection or for infusion. Benefits: can be highly effective for inflammatory arthritis. Risks: increased risk of serious infections. Very high cost. Need for regular medical monitoring. Insurance note: biologics are expensive and may require pre-approval from insurance providers. 6. Opioids and narcotic pain relievers. For severe pain, especially when other treatments fail, doctors may prescribe opioids. Examples: tramadol, oxycodone, hydrocodone. Pros: powerful pain relief for acute flares or after surgery. Severe risks: addiction and dependency, drowsiness and increased fall risk. Constipation, cognitive impairment. Guidelines for seniors: use only under strict supervision. Avoid long-term use. Never combine with alcohol or sedatives. 7. Topical pain relievers. Creams, gels, and patches can be applied directly to the skin over painful joints. Examples: capsaicin cream, diclofenac gel, Voltaren, lidocaine patches. Pros: fewer systemic side effects. Easy to apply at home. Limitations: effect may be mild or temporary. Not always practical for deep joint pain. 8. Combination therapy. When multiple medications are used. Doctors often prescribe more than one type of medication to maximize relief and minimize side effects. Example: Tylenol plus topical gel, or NSAID plus DMARD for rheumatoid arthritis. Watch for drug interactions, cumulative side effects. Importance of medication review. Seniors should regularly review all medications, including supplements, with their doctor or pharmacist to avoid dangerous interactions. 9. Prescription versus over-the-counter, OTC. What's the difference? Many joint pain medications are available both OTC and by prescription. The key differences lie in dosage, formulation, and intended use. OTC: lower doses, fewer risks, but may not be strong enough for chronic pain. Prescription: stronger, more targeted, but require monitoring and carry more side effects. Always consult a healthcare provider before starting or changing any medication regimen. 10. When prescription medications are appropriate. Prescription treatments are not for everyone, but they play an important role when pain is severe or disabling, inflammation is causing joint damage. Natural methods aren't enough. There's an autoimmune component, e.g., rheumatoid arthritis. Red flags that require medical attention: sudden swelling or redness in joints, joint deformity or inability to move, pain that worsens despite rest. Conclusion: the prescription path has power, but requires caution. Prescription medications have transformed joint pain treatment. For many older adults, they offer real, meaningful relief. But they're not a cure, and they're not without risk. Understanding how these drugs work, when to use them, and how to balance their benefits and side effects is essential. In the next section, we'll explore the natural remedies that offer pain relief, inflammation reduction, and long-term joint support, often with fewer side effects. Stay tuned for a deeper look at what nature can offer to those seeking a gentler path to joint health. Part 3. Understanding prescription treatments for joint pain. The role of prescription drugs in managing joint pain. When joint pain becomes chronic and interferes with daily life, many people turn to prescription medications for relief. These pharmaceutical options are often powerful and fast-acting, but they are not without risks, especially for those over the age of 60. In this section, we'll explore the most commonly prescribed medications for joint pain, how they work, their effectiveness, and the potential side effects seniors need to consider. We'll also address how doctors decide which medication to prescribe, and when prescription drugs are necessary versus when they may do more harm than good. 1. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs are among the most widely used medications for joint pain. They include drugs like ibuprofen, naproxen, and prescription-strength options, such as diclofenac or celecoxib. How they work. NSAIDs reduce inflammation by blocking enzymes, COX-1 and COX-2, that produce prostaglandins, compounds that cause pain and swelling. Benefits. Effective at relieving mild to moderate pain and inflammation. Fast-acting. Risks for seniors. Gastrointestinal issues, ulcers, bleeding. Increased risk of heart attack or stroke. Kidney damage, especially when used long-term. Doctors may recommend a topical NSAID gel to minimize systemic risks. 2. Acetaminophen Tylenol, often used as a first-line treatment for osteoarthritis. How it works. Acetaminophen blocks pain signals in the brain, but does not reduce inflammation. Benefits. Generally well-tolerated and safe when taken at recommended doses. Risks. Liver damage if taken in high doses or combined with alcohol. Less effective for inflammatory joint conditions like RA. Acetaminophen is often best for those with mild osteoarthritis or who cannot tolerate NSAIDs. 3. Corticosteroids. These powerful anti-inflammatory drugs are either taken orally or injected directly into the joint. How they work. Mimic the effects of cortisol to reduce inflammation quickly. Benefits. Fast relief for severe flare-ups. Injections can target pain precisely. Risks. Bone thinning, osteoporosis. High blood pressure. Elevated blood sugar. Weakened immune response. Due to serious side effects, corticosteroids are usually used short-term or sparingly. 4. Disease-modifying antirheumatic drugs, DMARDs, used primarily for autoimmune joint conditions like rheumatoid arthritis. How they work. Suppress the immune system to slow disease progression. Examples. Methotrexate, sulfasalazine, hydroxychloroquine. Benefits. Reduce long-term joint damage, preserve function. Risks. Liver toxicity. Immune suppression. Frequent monitoring required, blood tests. DMARDs require consistent follow-up and lifestyle adjustments. 5. Biologic therapies. A newer class of drugs for severe autoimmune arthritis. How they work. Target specific components of the immune system involved in inflammation, e.g., TNF-alpha. Examples. Enbrel, Humira, Remicade. Benefits. Can dramatically improve quality of life in severe RA. Risks. High cost. Risk of serious infections. Injection site reactions. Biologics are often used when traditional DMARDs are not effective. 6. Opioids, a controversial option. In rare cases, opioids may be prescribed for severe, intractable pain. How they work. Bind to opioid receptors in the brain to block pain signals. Benefits. Strong pain relief when other treatments fail. Risks. Dependence and addiction. Cognitive impairment. Increased fall risk. Constipation and other side effects. Given the opioid crisis, these drugs are typically a last resort. 7. Combination approaches and personalized plans. Doctors often combine several treatments to maximize relief and minimize risks. Examples. NSAID plus physical therapy. DMARD plus short-term steroid use. Topical plus oral meds for multi-site pain. A personalized approach considers the patient's overall health, coexisting conditions, medication tolerance, and lifestyle. Conclusion: prescription treatments are powerful but not perfect. Prescription medications play a crucial role in managing joint pain, especially in moderate to severe cases. However, for seniors, the benefits must be carefully weighed against the risks. The goal is not just to reduce pain, but to improve quality of life safely and sustainably. In the next section, we'll shift our focus to natural remedies: what works, what doesn't, and how natural solutions can complement or even replace prescription options. Conclusion: making the right choice for your joint health after 60. Now that you've explored the truth about joint pain after 60, understood the role of prescription medications, and discovered the power of natural remedies, it's time to make an informed, personal decision. Joint pain doesn't have to be a life sentence. Whether your path involves prescription medication, natural alternatives, or a balanced combination of both, the key is awareness, consistency, and early action. Here's some final takeaways to remember. Listen to your body. Don't ignore the early warning signs. Morning stiffness, swelling, or pain after light activity are signals to act, not avoid. Talk to your doctor. Before starting any treatment, natural or medical, consult a healthcare provider, especially if you're taking other medications or managing chronic conditions. Start with small changes. Whether it's adding turmeric to your meals, trying a gentle stretching routine, or reviewing your medications, small steps can lead to big improvements. Consistency beats intensity. The best results come from daily care, eating anti-inflammatory foods, staying active, and avoiding harmful habits like smoking or excess sugar. Quality of life matters most. Your goal isn't just less pain. It's more freedom, more movement, better sleep, and a fuller life. As we age, taking control of our joint health is one of the smartest and most empowering choices we can make. Don't wait until the pain controls your life. Take action now. Your future self will thank you. If you found this video helpful, please like, subscribe, and share it with someone who may be suffering from joint pain. Let's empower more people over 60 to move better, live stronger, and age with grace.